This segment featuring the art of medicine is sponsored by the Medarva Physician Network. To learn more, visit medarva.com.
Do you constantly feel like you have a cold? It could actually be allergies. Dr. Michael Armstrong from Richmond Sinus and Allergy is with us this morning, just in time for the looming allergy season. Dr. Armstrong, a lot of people are dealing with some classic allergy symptoms that they don't know are classic allergy symptoms, right?
That's true. A lot of times people just think that they have a cold and or that they chronically have a cold, and a lot of people mistake sinus infections for allergies. But the typical symptoms are itching, sneezing, runny nose, watery eyes, and asthma is a major symptom of allergy.
This is how the whole process started for me before I had discovery that I actually was allergic to things. I kept thinking it was this cold that never came on.
Right.
And then you can come in and there are tests that you can do to actually determine not only is it allergies, but what you're allergic to.
Absolutely. The traditional way is with a skin test, and it takes a couple of hours, but we can find out exactly what you're allergic to and also prepare desensitization serum so that we can actually cure the allergies.
A lot of people get hesitant about shots because they think, oh, if I've got allergies, that means shots.
Well, in most cases it does, but there are alternatives. Some patients will choose to put drops under the tongue. My son, for example, puts 4 drops under his tongue before bed every night. No shots, problems under control, he takes no medication.
And it's kind of a more pleasant way of dealing with it if you have an aversion to needles.
It's certainly an option, that's right.
Now, we said allergy season is on the way. Is there kind of a hallmark that you start looking for outside? I've noticed the trees are starting to pop a little.
I tell my patients to start taking their medication as soon as the daffodils bloom. And we've had a few warm days this month, but I was surprised to see this morning that indeed the pollen count has doubled in the last 2 weeks. So I think that it is here, and the next couple of months are going to be the peak of the tree allergy season.
And it's safe to say that it can come a little earlier some years and maybe later
With the warm
others.
winters we have, it's very unpredictable.
Yeah. So when you determine that you have an allergy to something, are there things that you can do? Is it just shots and drops, or are there things that you can get at the pharmacy, or?
Well, in theory, the best treatment is simply avoidance. If you can not be exposed to the allergy, if you can remove the cat from the house or remove the dust from your house, and dust is probably the one thing that we can do the best job of avoiding with mattress covers and good house cleaning. Unfortunately, with tree pollen, grass pollen, the weeds in the fall, you can close the windows, you can buy better air filters, but unless you plan to stay inside, it's a little hard to get away from them.
Yeah, you can't avoid it necessarily altogether.
Right. So what most patients will do is they'll start with an over-the-counter antihistamine. And fortunately, there are several brands now that are without a prescription, that are non-sedating, that are very effective. If that doesn't work, the next step we usually go to is an inhaled nasal steroid. They're extremely safe, 2 sprays in each side every day, and that will often control the symptoms.
Interesting. Now, this is also something that can evolve into a problem with sleep too, can't it?
Oh, absolutely. I remember my son snoring terribly before we found out he had allergies.
Yeah. And so allergy treatments can kind of help resolve that?
It resolved it completely.
Wow. I won't admit to any of that snoring. That is something, that's another conversation, but clearly there are things that you can do, you know, that really seem to help those things and get you back ahead of the curve. Are there treatments that you might want to avoid? We might have a tendency to go out and just go crazy buying over-the-counter
Well, the one
things.
thing that we discourage patients from using are the topical decongestant sprays, because they tend to cause rebound, and the decongestant pills can cause high blood pressure. So they're okay if you have a cold and you're stuffy and you need relief fast, but after a few days it's better to move on to something that's better for long-term use.
So definitely talk with your doctor about those things and make sure that you're using the right products.
And that's exactly what it says on the label.
Excellent. Great advice. Thank you very much, Dr. Armstrong. I appreciate you
You're
coming
welcome.
in. Just
Pleasure
in
to be here
time.
this morning.
Just in time. Find out more about Richmond Sinus and Allergy. You can give them a call at 622-3782 or find them online at richmondent.com or on Facebook at facebook.com/richmondent.